You had the same.
Yes, thank
Bye.
you. Not again. She also couldn't make it, so I'm going to present her work. This study was done in Tabriz University of Medical Sciences in Iran, in the Neurourology Research Center. The study topic is intra bladder wall mesenchymal stem cell transplantation in management of neurogenic bladder dysfunction. Neurogenic bladder is very common in different neurologic disorders as spinal cord injuries and multiple sclerosis, stroke, and it's generally a common condition. In this study that we designed, usually in the previous studies, after doing the spinal cord injuries, the mesenchymal stem cells were inserted in the area of the spine. But what we did was to insert these in the bladder wall, the mesenchymal stem cells. The study was done on 42 female Wistar rats. And we had 6 groups, and each one with 7 rats, a control, a sham, a hemisection, and that we did a normal saline injection. The hemisection group with the bone marrow mesenchymal stem cells, and the complete section with normal saline, and the complete section with bladder, the mesenchymal stem cells. This is the study timeline that, as you can see, day 0 shows the complete or hemi spinal cord injury or laminectomy. We monitored the mice for 28 days, and that was the time that bone marrow stem cells were inserted, or the normal saline was inserted to the bladder wall. And the final assessment, the urodynamic assessment, was done in day 56. As you can see, this is the procedure of spinal cord injury or hemi or complete transections were done. After the transection, this is the information about the medium that we used for the cell culture. That was a double echoes modified eagle medium with fetal bovine serum, 1 to 2% pen strip. The medium was replenished each 2 to 3 days, and the stem cells were used in a passage of 3 to 6. This is the process. This shows that the process of injecting the stem cells, we used a 500 microliter sterile plastic syringe, and it was injected with a 26 gauge sterile needle to the bladder wall. This is the urodynamic device that was designed by the medical engineers in Tabriz. So it was a self-designed for studying the urodynamics in mice. This pursed string suture for catheter insertion, this process shows the process of exposing the bladder and inserting 2 catheters, one for the water perfusion and the other one to the device for urodynamic studies. Because of the manipulations that the mice make and with the wire and the catheters, you can see in the this image that the catheter is we drove it from the behind the back of the rat. So the results. This is the results of the urodynamic studies that was in 7 groups. As you can see, the peak pressure, these are the complete dissection and the hemi-dissection. These are the 2 groups, and the control and the sham group. That, as you can see, there's a meaningful statistical difference between the you can see in the control group and the complete section, and also these show the hemi sections and the mesenchymal stem cell injection. These two rows. This is for the complete section plus mesenchymal and the hemi section, and you can see the statistical difference that was meaningful for baseline pressure and also for peak pressure. The residual volume and the amplitude of inhibited contractions was also meaningful for the two groups. For the by two groups, I mean the hemi and the complete section plus mesenchymal cell injections. And it was also true for the contraction intervals and bladder compliance. This is an image of the mesenchymal after the injection of the mesenchymal stem cells. These are the dissections of the bladder to study the apoptotic cells in different groups. As you can see, also in these images, the apoptotic cells decreased in the places we injected the mesenchymal stem cells. Two proteins were studies, the BDNF and the CFOS in the bladder tissue, and you can see the image of the statistical meaningfulness of these mesenchymal stem cell injected groups, and a differentiation of the mesenchymal stem cells to small muscle acting using mouse anti-human alpha SMA antibody, and also the difference was meaningful in this.
Can you move it to conclusion, please?
Yes.
Because we are out of time.
Yes.
Sorry.
As a conclusion, there was more improvement in the hemisection group, and the urodynamic studies were both statistically meaningful in two groups, and was better in the hemidissection group. And last point I want to make, that the spinal cord injury increased the expression of CFOS as a neurotoxic biomarker in the bladder and spinal cord, and treatment with stem cells reduced its expression in both organs. That's it. Thank you very much.
Thank you.
So we'd better just say one question, please, Matt. Nice, yes. Quick one.
Really quickly, it's the first time I ever saw anybody measure CFOS in the bladder, and in muriform rodents, there are no neurons in the bladder, so I'm wondering what it means.
There is main question regarding the effect of stem cell therapy. Is it local or central? We can measure CFOS to see if there is some central effect of this kind of implementation of cells, and we found just significant results for hemisection group, not for complete group. This is another just opening the door, maybe for hemisection group, that continuity of neurons established, C-phase change, but not for complete group. That's why we measure it.
Thank you very much.
Thank you.